Welcome. My name is Natali Murdock. I'm a cannabis-trained registered nurse here with Leaf411. Today I'm going to discuss the different routes of administration or ways to consume cannabis. This is a pre-recorded segment, but I am available live in the Q&A, so please drop any questions that you have during or after the presentation. Thank you so much. Inhalation is going to be one way to consume cannabis medicine. It's going to hit you within a few seconds to a few minutes. The peak can be expected in about 30 to 45 minutes, depending on the different potency of the flower. And the duration can be anywhere from 1 to 4 hours, just depending on the individual person. There's a couple different advantages to inhalation. You're going to be able to use it for quick pain relief, for nausea, for instance, for an instant type relief. Something like falling asleep, using an inhalation method is going to be a good way to consume the product. There's some disadvantages when you're smoking, like lung and airway irritation. If you're someone who's never experienced smoking before, it can be quite irritating to the lungs and may cause a lot of coughing. So it may not be the best form of medicine for you. Vaporization, if you still need a quick acting form of cannabis, may be the better option. It is going to be a much cleaner way to consume cannabis medicine. This is because you're not going to be putting a lighter to it. It's going to heat up the flower at a much lower temperature. There's little odor to this, less toxicity to the lung and airways. And again, it's a smokeless form to take in the product. There's some concerns when you're vaporizing, specifically when you're using oils. You have to be careful about what's being put into the product, different thinners or different thickeners, in a more concentrated form of potentially pesticides, etc. The best way to inhale with the vaporizer is to use flour, grind it up, and put it in a device where something like some sort of device where you can vaporize it. There's different devices out there. And then again, if you're using a vape pen, like an oil vape pen, you just have to be very specific about the quality of the pen and what's actually in the product. Talking about different forms of inhalation and smoking, flower is the buds like this that you can buy at a dispensary. When you grind it up, you put it in a grinder. You take off the top, put the flower in here, and then you would grind it up, and you'd have a fine little pieces of it in there. When using flour like that, you can use it with a vape pen, something like this, where you actually load this with flour, and then you can turn it on and inhale this way. Another form of inhalation is the vape pen, where there's oil in it, and then you usually just inhale, or there's a button you can press to inhale that way. And usually cannabis flower is going to come in a variety of different packages, either a plastic package or a jar. And on the back, it will tell you what the product is, and it should tell you what the THC strain is, the potency. Another form of taking in cannabis medicine is ingestibles. There's different forms to take in this type of medicine: capsules, drinks, edibles. This is going to be a very, maybe not a super consistent way to take in the medicine due to the different bioavailability or ability for your body to absorb it. And sometimes the accuracy of ingestibles can be all over the place. There are some different types of technology where the onset may be quicker than 30 minutes, maybe 5 to 15 minutes. There are some products like that, but in general, it's going to be about 30 minutes to 90 minutes for the onset to hit you. With that, you do want to wait a bit longer. If you take in an edible and you don't feel it right away, you want to wait at least an hour and a half to see how it's going to affect you. The peak generally is about 2 to 3 hours, and it generally is going to last about 6 to 8 hours, but it can definitely last longer in your system depending on your metabolism, depending on if you ate a heavy meal right before you took an ingestible or if you're taking it on an empty stomach. It is going to be converted in your liver over to 11-hydroxy-THC, which is a more potent form, which is why oftentimes when people take in ingestibles, they feel much more intoxicated, and sometimes it can last much longer. Some of these negative effects of feeling intoxicated, maybe for 12 hours, can be avoided by starting with very low doses and increasing very slowly. Some of the different benefits of taking in ingestibles are it may be really relaxing to your body. It can be very sedating, especially when you're leaning towards indica type strains that have different terpene profiles that are more for sedation. There's different advantages to ingestibles. No smoking. It's very discreet. Again, some of the disadvantages are product consistency. But nowadays, there's lots of different products where you can dose pretty low down. You can microdose with edibles as well, down to like 1 to 2 milligrams, and really see how it's going to affect you, and then increase slowly from there over time until you find the dose that's going to be best for you. When it comes to ingesting cannabis, please keep in mind the dosing on the package. Generally, it should be scored if it's a 100 milligram chocolate bar, for instance. It should be scored in 10 milligram pieces per dose, but this is very dependent on the state that you're in. So please look at how many milligrams are in the package, and then if it's scored, and if it's not scored, I highly recommend finding a product that is very obvious that one piece, for instance, is 5 milligrams or one piece is 10 milligrams. So you don't end up taking way too much of an edible, because then you're going to be left with it lasting in your body potentially 6 to 8 hours, which could be very uncomfortable. One other point to add when ingesting edibles: if you did ever take way too much on accident, CBD is a great remedy to help even you out and help you not feel quite so intoxicated. Another form of cannabis medicine is sublingual tinctures. There's a few different forms: alcohol-based, oil-based, and then there's also strips, dissolvable strips that are around. These are all going to be absorbed through your mucosal lining in your mouth, usually placed under the tongue. The onset's going to be a bit quicker, 15 minutes to an hour, sometimes even a few minutes, with, again, some of the different technologies that increase the absorption rate in your body. The duration is about 6 to 8 hours as well, and you don't have as much conversion in the liver, but maybe still slight due to it eventually being swallowed. Some of the advantages are it is a quicker absorption generally than oral. Again, you avoid the smoke, you have no odor, it's discreet, and specifically with the sublingual tinctures, they can be very beneficial because you can dose down to 1 milligrams, 2 milligrams, and really get specific with the dosing that's going to be best for you. And then you can titrate up as needed over time. Most tinctures are going to come with a dropper that is usually graduated, so it's dosed out down to 0.25 mils, 0.5 mils, and 0.75, and the whole dropper is usually 1 milliliter. And so if you find a tincture where it doses down to 1 milligram per drop, it's easier to dose. And the other one form of dissolvable strips are little tabs like this, where you can break them off and put under your tongue and let it dissolve. Topical application is another form of cannabis medicine. You have ointments, salves, lotions. Generally, you're not going to be intoxicated from using this type of application. There's a very minimal amount of product that's going to be heavily absorbed into your bloodstream, but it can be very beneficial for things like arthritic pain, rashes, psoriasis. You can use different cannabinoids this route as well, THC, CBD, CBG, CBN, they're all going to have different benefits when used topically. And you can pretty safely just apply this as needed throughout the day. If your pain starts to come back after a few hours, you can pretty comfortably put more topical on without being concerned that you're going to get heavily intoxicated. Again, most people don't feel any intoxication from topical applications, but there are some people who do. And using topicals, there's different options like salves, lotions. I would say if you have cracked skin, you have any open wounds, it's very important to make sure that there's not alcohol that could potentially burn your skin, or different essential oils like peppermint, cinnamon, cloves, things that can be a little bit harsh on the body. It can cause kind of a reaction again with open skin specifically. However, topicals can be a great way to heal wounds and psoriasis. They can be potentially beneficial for age spots, for helping your skin on your face, different parts of your body. Specifically for pain, it can be hit or miss for some people. Some people find really good relief from topicals, some people do not, and it's going to be product specific as well. So definitely be willing, like all cannabis medicine, to give different things a try. There's transdermal patches as well that can be used in the topical form. With those, you do want to just look at the ingredient list, just like any topicals, just to make sure you're not allergic to anything when using those types of routes. For rectal suppositories, there's not a ton of literature supporting that it's easily absorbable in your system. And there can be a concern for people who are immunocompromised, or, for instance, going through chemotherapy, and their mucosal lining may be easily torn. So it can be concerning to put a rectal suppository in. Also, most people would have to make their own rectal suppositories because there's not many rectal suppositories available for purchase. So this would be probably your least likely way you want to consume cannabis, but there are sometimes questions about that option. Again, in the literature, there's not a lot of support for rectal suppositories right now. Thank you so much for joining me today. If you have any questions, please drop it in the Q&A on the chat function. And there will be a Leaf411 nurse available in the Leaf booth after 5 p.m. today.